Hello and welcome to my channel. I am Dr. M.D.Zafar and I talk about the core concepts related to the IMM surgery and allied. Today the topic of our discussion is surgical wound classification. A bit overview in terms of the MCQs. So if there is a question that there is a simple appendectomy case, it will fall in class 2, that is the clean contaminated. However, if there is a complicated case associated with either perforation or gangrene, then it will directly fall into class 3. So you have to be very clear in terms of remembering the examples and try to fit those within the specific class in order to ace your MCQ. So now we will talk about the 4 classes of surgical wounds in detail. So the very first class is the clean. In this, there is no inflammation and there is no entry to any system of the body, including the respiratory, GIT, genitourinary, or biliary tract. The examples include hernia, thyroidectomy, mastectomy, other breast surgeries, and closed orthopedic cases. And the chances of infection is only less than 2%. The second class is the clean contaminated wound, in which there is an entry into the system but without any unusual contamination. That includes elective cholecystectomy and bowel resection with good preparation and cystoscopy. However, the infection rate in this is 5 to 10%. Then we have the class 3, the contaminated one. In this, either an open, fresh or accidental wound or cross spillage within any tract, specifically could be GIT or genitourinary, or a major break in sterile technique will convert the wound into a contaminated one. So penetrating trauma less than 4 hours will be contaminated. Inflamed but unperforated appendix is type 3, and if there is during cholecystectomy any sort of bile spillage, it will convert the wound from class 2 to class 3. So the rate of infection in contaminated wound will be around 10 to 20%. So the type 4 or the class 4 is a dirty or infected wound. In this, any old traumatic wound with necrosis or purulent discharge or a perforated viscera with existing infection will directly come into dirty or infected wound. In this, if there is a traumatic wound of more than 4 to 6 hours, it will become dirty, and abscess and bowel perforation will come into dirty or infected. In this, the risk of infection will be more than 20%. So you have to not only know the definition of each, but you should be very much clear about remembering the examples and the infection risk. So now an overview of the infection risk in these types of wound with prophylactic antibiotic and without antibiotic. So in clean class with prophylaxis, there is only risk of 1 to 2%. However, without prophylaxis, it remains the same. In class 2, the clean contaminated, with antibiotic, the risk is between 3 to 5%. However, without antibiotic, the risk would increase from 6 to 9%. In the type 3 class, in class 3, the contaminated with antibiotics, the risk of infection is only 6 to 13%, but without antibiotic, it will increase to 13 to 20%. In the class core, the dirty wound, there is risk of infection with antibiotic around 7%, but without prophylaxis, it would increase to 40%. So this was a brief overview about different classes of surgical wounds. So thank you very much for listening to this lecture.